I am currently in our locker room and just changing for my scrubs.
Nice.
Working as a PACU nurse is very different compared to what I've done before in my nursing experience. I used to be an ICU nurse, and having a critical care knowledge is very helpful in PACU. In this video, I'm going to talk about PACU nursing. PACU stands for Post-Anesthesia Care Unit. PACU is also called a recovery room. As a PACU nurse, our main job is to assist patients coming out from surgery and to make sure that they have a smooth transition recovering from anesthesia. So basically, the OR nurse and the anesthesia provider brings the patient from the OR to PACU. Once they arrive, we get report from the OR nurse and the anesthesia provider on what kind of surgery they have and the medications they get while in surgery. We also hook them up with heart monitors, oxygen saturation monitors, blood pressure, and all other stuff to monitor their vital signs. Once the patient is in PACU, we initiate orders written down by the anesthesia providers that are specific only to PACU. These orders can vary, but the most common orders are to monitor vital signs every 15 minutes, give pain medications every 10 to 15 minutes, give anti-nausea medicines, lab draws, and so on. Ideally, patient stays in PACU for an hour, but it just really depends on their Aldrete score that we assess every 15 minutes. On a good case, once patient is back to their baseline, like they're awake, moving all extremities, pain is under control, no nausea, vital signs are back to their baseline pre-surgery, then we call the anesthesiologist. The anesthesiologist then comes to see the patient, and then he or she will sign the patient out, meaning he is cleared from anesthesia care. Then we initiate phase 2, meaning we discharge the patient home, or phase 0, meaning we hold them until they can go back to the floor or until they get a bed from the floor. Now that's the ideal scenario of a patient staying in PACU. They recover from anesthesia, then they go home or go back to their assigned floor. But when hospital beds are full, that is where it gets tough, not just during the day, but also during night shift. You see, some patients coming out from surgery do not have an assigned bed because they may be coming from ER or outpatient being admitted to the hospital. If that's the case, they may have to wait until bed is available. We call those patients holds, since we're holding them until they get assigned to a room. Once they get a room, we call their primary nurse to give report. From there, either we request transport to bring the patient to their assigned floor, or we take them ourselves depending on the acuity of the patient. Then once we transfer the patient, we finalize our documentation and wait for our next patient to arrive. But during night shift, some patients do not get assigned a bed because again, the hospital might be full. So they ended up staying in PACU overnight. Hence, we're holding them. The issue is there's only 3 night shift nurses working after 11 p.m. We don't even have a CNA, maybe just rarely if ever. But if we get multiple recoveries from trauma patients like motor vehicular accidents or gunshot wound patients, that is where it gets really difficult. Holding patients and recovering patients at the same time can be tough because we don't know how unstable that patient is coming out from the OR. You see, those patients may require full attention from the PACU nurse to make sure that there's no active bleeding going on, and may require for that nurse to stay at bedside for a longer period of time. And because we're holding other patients, we may not be able to attend to their needs. Not to mention, we also hold other critical care patients that are waiting for an ICU bed, and those patients require constant monitoring as well. That is why, in my opinion, it's very important that a PACU nurse must have some form of critical care experience before working in a PACU. That way, if it gets very busy, he or she can rely on his time management and critical care skills. Fortunately, my coworkers are great team players. We always watch our backs and help each other out to give the best quality care for our patients. Overall, I really enjoyed working in PACU. Just like any other nursing floor, it can also get very busy and can be very stressful. But again, having a great coworkers can really make a difference. So if anyone watching this video is planning to try PACU nursing, I think you should try it. It's very different compared to regular nursing floor, and most of the time, you're only holding a patient for a short period of time and on to the next patient. That's all for tonight. Thanks for watching, and don't forget to subscribe, like, and comment. Again, thanks for watching. Until next time.